I'm here to interview Dr. Paul Weeks as part of the ICON project, which is co-sponsored by the American Association of Plastic Surgeons and the American Society of Plastic Surgeons. Would you state your full name, Dr. Weeks?
Paul Weeks.
Okay. Where were you born?
Clinton, North Carolina, a farming community in eastern North Carolina.
Okay. And your parents' names?
Joseph Isaiah Weeks and Margaret Ruth Weeks.
I always ask this question, what did your father do?
My father was a veterinarian, one of the really earliest veterinarians in the state of North Carolina. And he practiced for probably 60 years, 70 years. My parents had quite exceeding longevity, both of them did, and so they were active until really the time until they died.
When you say exceeding longevity, how long
Well,
did they
my
live?
mom died at 104,
That's-
and my dad died at 89.
Okay, okay. Do you have children, grandchildren, great-grandchildren? You want to mention their names? And
Sure. Well, I don't know about the grandchildren's names, but we have 6 children. My wife is Doris. We've had 6 children, 2 of whom are in the medical profession, 2 of whom have advanced degrees in business administration, and the other 2 are engineers.
okay. And how many grandchildren do you have? You don't have to name just.
11.
Okay, all right. Where did you meet your wife?
I remember clearly the first day I met her, which was in the operating room at the University of North Carolina. She had just finished anesthesia school and was accepted for a job at Carolina. I was working on a patient, and she walked in the operating room with a green outfit on, a green cap, and a white mask. And all I could see were her eyes. And I said, oh boy, this is it. And a year later, we were married.
How long have you been married?
55 years.
Wow. I'm impressed. Okay. What inspired you to go into plastic surgery? And at this point, if you want to mention any mentors or anything, how you got to this field?
Well, this is it's a complicated story on ending up in plastic surgery, but basically, I never did any research until I was at Duke, where I did my undergraduate work. And as a senior, I went to the Dr. Bookout ran the Duke Marine Lab, and I spent a summer down there. And first thing was such a simple thing as counting the number of barnacles that accumulated on plates that were painted with paints that Sherwin-Williams provided, and just count the number of barnacles and see which paint worked best for preventing barnacle accumulation. So that actually was a scientific encounter. And then when I went to medical school, which was at the University of North Carolina, we were required to write a thesis by our senior year and to do original research. And for some reason, I had become interested in immunological tolerance. And this was in 1954. And so my project was to inject black mice with cells from white mice and make sure that the embryos were exposed to these cells, and then to challenge them with a skin graft, which was the best measure of rejection. And so I was sent by my mentor over to see a fellow named Tim Thomas, who subsequently became my surrogate father, and he referred me to Earl Peacock, who was just finished his training in plastic surgery. And Earl was going to show me how to do skin grafts. And the rest of it was sort of history, in that we started doing skin grafts, and then one thing led to another, and I became interested in healing of wounds. And the best place to study this was in the upper extremity, especially the hand, because you had nerve, bone, tendon, and others, blood vessels to heal. So you could study all of them at once. So I became very interested in hand surgery through the research and through being associated with Earl. And that just continued on. By the time I finished residency training, I had been awarded an NIH grant, which I was, at that time, didn't think a great deal about, but it turns out to be a life-changing matter, in that I had thousands of dollars to do research. And I initially was going to stay at the University of North Carolina, but Ben Eisman, who was the new chief at a newly formed hospital medical school in Lexington, Kentucky, the University of Kentucky, invited me to come out there and start practicing plastic surgery and setting up a division of plastic surgery. And so one thing led to another, and we had a very active research laboratory, and it was a great experience at the University of Kentucky.
Yeah, and I think we discussed this. This is probably early stem cell research. That the concept of it.
It was interesting.
You didn't think of it that way.
My wife had, of course, 6 kids, and I got the placentas from her after her delivery, and 4 of them, and used them to isolate chondroitin sulfate and sulfuric acid. So that, which was the makeup of so-called ground substance, which now we call mucopolysaccharide or glycoproteins. And my first paper, or not first paper, but first really good paper, was on the interaction of collagen and glycoprotein.
Okay. And during your career, your life, you've seen paradigm shifts in plastic surgery. And what I would ask you is, what stands out in your mind as, some of the great changes in plastic surgery?
Well, I think one of the really major changes was developed by Harry Bunke, which was microsurgery, because microsurgery has been adapted by almost every specialty now, and it made it possible to study things that we in the past have not been able to study. So if I name one advance that plastic surgeons had made, would be in microsurgery. But now tissue engineering is coming along, and tissue engineering is going to be the field where the major advances are made. And I hope that plastic surgeons will participate in this and not just basic scientists.
Okay. So I'll say that covers our greatest innovation, our specialty, which was one of my questions. My next one is, what's the greatest mistake we've made as a specialty, in your opinion?
I think the greatest mistake was the fact that we did not demand to be a department. So many people wanted the job and wanted to participate in the university, which is to be commended, but they would not stand and say, we want a department. Because if you don't have a department, and I did not have a department, and you could ask me why I didn't have a department, and the answer was simple. I was at Barnes Hospital, Washington University in St. Louis, and for instance, radiology had numerous specialties that were actually contributing more than I was contributing. And if the dean or the powers to be had made me a department, then the next person would come along and say, I want to be a department.
Okay.
So it was a matter of keeping everything together, but keeping everything together did not benefit plastic surgery. Unfortunately, one of my closest friends, Josh Yurkewicz, was a general surgeon and then subsequently plastic surgeon, and contributed terrifically to plastic surgery and to general surgery. And he identified so strongly with general surgery and felt that we should all be general surgeons first and then plastic surgeons, that it sort of set the tone for plastic surgery. But
How do you feel about that now? Do you feel that because the efforts are now to go to a multidisciplinary 5-year program, general surgery a year or two, then the rest plastic with fellowships afterward?
Well, that makes sense. The problem with general surgery in the past, and including general surgery, is that the residents really, or interns, whatever you want to call them, don't get surgical experience. They can go 3 years and not do an operation in many programs. So I don't know how we're going to work that out, but I think that what we have to do is be a specialty and be a department, because we need, and this sounds terrible, but we need to control our monies, because we cannot develop our specialty especially in university settings, without control of our monies. Like when I was practicing, 25% was taken off the top, and that went to the Department of Surgery. And then the chief of surgery could do what he wanted to with it, but it didn't benefit me or my department. Right. That's what I really wanted. So that's one major reason for going to a department. And it's going to take a tough stand. And you're going to have to find people that will say, the good people that will say, I will not come to your department, your surgery department, unless I am a department of plastic surgery.
What do you think is your greatest professional accomplishment?
Well, the greatest accomplishment was talking Doris Hill into marrying me. Okay, so
professional or personal?
Right, that definitely was a big accomplishment, which I've never regretted. But professionally, the thing I think I really accomplished was in training people to be really complete plastic surgeons. I enjoyed it so much, and I never got up in the morning and didn't want to go to work. And in those days, many years ago, the residents would come in on Saturday mornings, and we would sit around for 2 or 3 hours and have conferences and talk about the patients that we had done during that week. And they did not know which patient I was going to call. And so they would all be ready. And it never was confrontational. It was understood that we were there to learn. And I think from an educational standpoint, I did a good job. Now, as far as professionally, outside of that, I think the establishment of a first hand center at Barnes Hospital, which was controlled and in plastic surgery, the establishment of a cleft lip, cleft palate, craniofacial center, which eventually Jeff Marsh took over and ran, and the establishment of hand surgery as a significant part of plastic surgery. So we actually had 12 attending staff, and they covered the spectrum of plastic surgery. So if a person was primarily interested in, say, cosmetic surgery, he could come and go through our rotations, go through everything, be exposed to it all, and then we would send him off for a year to work with someone who was really recognized internationally as an outstanding cosmetic surgeon. And we did this with kids that wanted to learn breast reconstruction with Carl Hartram down in Atlanta. We'd send them to Taiwan, Fuchen Wei, the microsurgeon over there, who was so good, and we sent them to France. We sent these kids wherever they wanted to go, where what they wanted to learn. But unfortunately, the Plastic Surgery Board came along and said, you can't do this. And so we had to stop that, even though it was the best experience, if you ask any of these kids, they could possibly have.
Well, I appreciate that. Yeah, I understand. Now, how about your greatest professional disappointment?
Oh, near the end of my tenure, I had a resident named Raul Nath who did terrific research work in our laboratory, and it was my laboratory that I had established, and Raul was nice enough to put my name on the paper. And he sent it in to plastic surgery. It came back while he was out of town for a week or two. And it sat on the desk, and finally I told the secretary, I said, I'm sure Raul's done a great job, just send it back to the Plastic Surgery Journal. Well, she sent it back to the Plastic Surgery Journal, and it came out, published, and had my name on it. It did not have Raul's name. And he should have gotten all the credit for what was done, but there was no way you could ever recover this.
Yeah, you could put an addendum, but nobody ever reads those.
No one ever reads them.
Yeah,
huh?
Right. Yeah.
No one would ever read. And
Well, now you've honored them.
That was really that was a bad deal for everybody. Okay. But and it was probably my fault that I didn't read the paper.
No, I understand. What has been your greatest joy?
My greatest joy was my residents. I had fantastic residents in general and in particular. And these kids were just like my children. I loved them. I just, we learned together. In the hand center, which I started, we had two therapists, Patty Phelps and Ginger Woods, who started a hand center in 1971, just celebrated its 40-some anniversary, and it was all in plastic surgery. And these girls, and I call them girls all the time, and they love it, but other people think that's impolite. But
not politically correct.
That's right. But I loved them, and I was just with them recently, and we trained a lot. They trained a lot of therapists that went out around the country and set up hand therapy as their specialty, and were great at it. So that was a lot. I was very blessed. Most everything I did, I thoroughly enjoyed. I really did. It was just, get up. Let's get up this morning and let's go to hospital.
That's a great job, isn't it?
It was a wonderful job.
Okay, so who do you admire most, professional or personal?
Oh, that's, I have to tell you a story first before I can get them all in. But number one, when I left, well, that's not true. When I went in to start doing this research, on immunological tolerance, Tim Thomas became my surrogate father for some reason. He was about 15 years older than I was, and he was just, I don't know how you explain it, but you just loved the guy, and he loved me, and it was just a wonderful relationship. Unfortunately, when I retired, he was still in Chapel Hill, and we were the best of friends for 16 years, played bridge together and so forth. And I really admired that man. But there were others who were plastic surgeons who were very instrumental in what went on with me. And one was a guy named Andy Moore. And Andy Moore was in Lexington, Kentucky. And when I left as a resident one day and as now a plastic surgeon the next day, I needed some help. And Andy was in practice in Lexington, Kentucky. Well, we became the best of friends, and he introduced me to everybody you could ever imagine in plastic surgery, because everybody liked Andy. He was a wonderful man. It was just fantastic. So it turned out that Andy's father was chief of radiology at Mallinckrodt Institute in Barnes, where I subsequently went. And he was very, very instrumental in my career. I was very lucky.
Okay. Would you give us your words of wisdom for present and future generations of plastic surgeons?
Wow. Well, again, I think there are two levels. One is the people that are in academic surgery, and then the ones who are in private practice. And I have had residents who've gone out in private practice, and I am extremely proud of them and what they have accomplished in their communities and by the way they conducted themselves and the contributions that they made to the community. So I think that's very important. The academic plastic surgeons, I think you have to push to be have an independent department status. You have to. You can't develop. You can't use your funds to develop your department, your group, unless you control them.
Your words of wisdom for retirement.
This is, I left when I was 65, and I told the chief of surgery that I was through and I was not going to participate in anything else. It wasn't that I didn't love it. I did love it, but I had seen so many people stay on too long, and they should not have still been operating. So I said, that's not going to happen to me. I'm going to go out and practice. I'm going to go out and retire. And what I did was I have always loved working with my hands and making things. And so I have a well-furnished workshop where I can do most anything you want to do with wood. That's number one. And by the way, I would buy one of those saws that stops when it touches the
infrared one.
Yeah, right. I definitely would if I bought a new one. But I think you have to have something that you really love doing like that. And if you don't have any inclination toward doing sort of things, I think reading can get old. I think golf can get very old. In fact, I played golf for 4 or 5 years and got bored. But there are a lot of things you can do in the community, and you can join associations and can associate with individuals who are not in the medical profession. Like almost all of my friends are not in the medical profession now because I belong to a Kiwanis Club and a golf club, a country club and a few other things like this. So I think as long as you have activities that you can keep doing, and the second part of that is you ought to have a 2-story house. And the reason, number one, is you got to walk up and down the steps every day. Apparently, and this is my own theory, people that live in 2-story houses live longer because of their activities. And it also is a good place for your wife to be able to get away from you.
Or vice versa.
Yeah, right.
We talked a little bit, and you hadn't mentioned this. I thought it was intriguing. I think it's part of our personalities that you told me that you built a log cabin, but you built it from the bottom up. You cut the trees down, you cut the wood, you put them together. And I thought that was interesting that it wasn't like you got a kit and put it together. You built your own log cabin. In Clinton.
It's right here.
Oh, in Durham.
It's right by a little stream. I live on a farm. I tried to talk my wife into going to a retirement community because I thought she would want to, and she said absolutely not. And of course she's right again. If I went in a retirement community, I would be living in an area about like this, and I couldn't handle that. I need to be out doing things.
Okay. Well, that goes with a retirement concept.
Yes.
Okay. What are your predictions? And we kind of touched this, but if you want a prediction for plastic surgery in the next quarter century, if you could fast forward then, what do you think you'll see, innovative or otherwise?
I think that what's going to happen is that they are going to modify this turf battle quite a bit. Because when I first came out in the 60s, turf battles were what it was all about. We were fighting with the oral surgeons, and we're fighting with the otolaryngologists, and you name it, and turf battles were a big problem. Our problem is we don't have an anatomic area that we are identified with. And what we need to do is we need to join a specialty, and I would, first thing I would think of would be otolaryngology, but to join another specialty that has an anatomic area, and then we work together. Okay. I would just say one thing about my family, because I was very fortunate. I was born into a family which was, when I was born, they had lost their home. This was during 1932. They lost their home in 1930. On top of that, my dad had polio when he was 2 or 3 years old, and his leg was about as big as my forearm. And he lived for 89 years as a practicing large animal vet, and he never complained about anything. And the more I think about what he accomplished, the more I admire him. I'm really sorry I didn't talk to him more about it. My mother was born into a family which was, I will say they weren't poor, but they didn't have anything. And that was in Newcastle, Pennsylvania. And her father was did odd jobs in the town until he became a railroad conductor. And mother was one of 3 children, and her father decided that she would be the one to go to college, the first one to go to college in the whole line, which was the same thing with my dad. No one went to college for 50 or 100 years, and there wasn't anything then anyway. But my mother went to Grove City College, which is a little town near Newcastle, And then after that, she went to the University of Chicago and graduated with an advanced degree. Then she became a school teacher, which is about the only thing women could do in 1914. And for some reason, she quit teaching school and in some way arrived in Goldsboro, North Carolina, where my father was staying at staying in the same house, taking a boarding house, and he met my mother in 1920, and they got married. And they had nothing. My dad was selling mules at that time. I have some wonderful pictures of J.I. Weeks, trader in horses and mules.
Wow.
At that, but they are all of their kids, my two brothers and myself, all ended up with advanced degrees, and all were recognized for one reason or another. So that was a great story.